Hi guys, today I'm going to give you a lecture on healthcare. So the chapter started with a social problem, which is the uninsured population in America. America is the only industrialized country that does not provide healthcare coverage to all its citizens. So here is the profile of all the uninsured population. Children living in poverty were more likely to be uninsured. Young adults were the least likely of any age group to have health insurance. People living in poverty, also in terms of racial and ethnic characteristics, African Americans, 12% were uninsured. Non-Hispanic whites was 9%. Hispanics were almost 21%. Foreign-born population were more likely to be uninsured comparing to their native-born counterparts. And interestingly, geographic location also makes a difference. Northeast and Midwest are more likely to have coverage than South and the West. Okay, so there are a few major programs. So the whole healthcare system is really complicated, so I'm just going to follow the chapter and give you a brief overview on both Medicare and Medicaid. Medicare have 4 different coverages or different parts: compulsory hospital insurance, supplemental medical insurance, the Medicare Advantage program, the Medicare prescription drug program. So this is Part A, the HI. Under HI, you get coverage for inpatient hospital care. So like the title suggests, it's hospital insurance, skilled nursing facilities, and hospice care. There's a difference between skilled nursing and regular nursing homes. Skilled nursing is typically temporary, just like hospital care. The ACA or Obamacare requires most Americans to have minimum essential care insurance. Medicare Part A counts as the minimum essential coverage. Okay, this is information about enrollment of this coverage, and the most important thing is the mandatory, and it actually enrolls you automatically after you turn 65. Part B, this one you have to pay for a premium. Part A is free because you paid Medicare tax already. So this one requires a premium. In 2019, the premium for everybody is $135. It's optional, but it can feel mandatory because there are penalties if you don't withdraw the coverage on time. Part B, again, like the title suggests, it's a medical insurance. Okay, it works similarly as what we get from our private health insurance policies. So it covers doctor's services and other outpatient care, such as lab testing, diagnostic or preventive care, and some home health care services. So you'll probably notice prescription drug is not covered, right? So Part C is a private option for people who needed more coverage. So basically you're buying your own insurance under Medicare. Many private insurance companies offer this option, and they also offer, not all of them, most of them offer prescription drug benefits. So Part D is the prescription drug coverage portion of the original Medicare, which means the drugs you fill at the pharmacy. See, this is where it gets complicated. Part C has prescription drug benefits. I think Part A, B, they also have prescription drug coverage, but they cover different drugs, like the drugs you get while you're hospitalized are covered by Part A, actually. So, but Part D is the coverage for you to fill your meds at a pharmacy, which is most common, right? Part D is also provided by private plan providers. Okay. See, Part D is kind of like a complement to Part C for those who have Part C coverage but don't have drug coverage under Part C. Again, it's really, really complicated, and I don't understand why it has to be this way. Okay, so this is the gaps in terms of Medicare. Okay, Medicare does not cover long-term care, also called custodial care, if that's the only care you need. Most nursing homes, like the regular nursing homes, not the skilled nursing facility, most nursing homes is custodial care. Custodial care covers a range of services and support for you for your personal care needs, and they don't count as medical care. Instead, most long-term care is to help with basic personal tasks of everyday life. Okay, so this is one gap. Okay, a lot of people do need long-term care, but Medicare is not covering it. I guess they have to have their kids, or they have to pay themselves. So looking ahead, I don't think Medicare will cover this anytime soon, because most Americans don't like nursing homes. They want to live independently. And yeah, so Medicare has another thing which is often called donut hole. Okay, donut hole is happening because under Part D, beneficiaries who have high prescription drug expenses, they have to pay more when the total cost of their medicines reaches a certain threshold. So maybe they're only covered for like maybe $5,000 per year, okay? And then after that, they have to pay the full amount. Okay, this is called donut hole. So just a little bit on the Medicaid. Major groups covered by Medicaid typically is children living in poverty, is adults, childless adults, who may be eligible for SSI. Okay, pregnant women also covered. So this is federal rules. Okay, of course, states have different rules or different coverages for their own Medicaid program. Some states are way more generous than other states, especially when it comes to the coverage for childless adults. Okay, Medicaid pretty much covers all services and drugs, okay, inpatient or outpatient, prenatal care, vaccines, physician services. Okay. And the funding of Medicaid mostly comes from federal and state does have to provide a matching fund. Okay, so we kind of talk about this part. So other than children, actually non-disabled adults were the second largest group. Non-disabled adults, okay, whether they have kids or not. And there's also people who receive both Medicare and Medicaid. Okay. Children are the largest group, 51%. Okay, this here is why children is the largest group, okay, because we don't want children to live in poverty, and we don't want them to suffer, okay? So that's why there's expansion on the federal level that says eligibility for children must be extended to at least 133 of the federal poverty line in every state. So this does not mean the adult who live in the same household with the same household income will also get covered. It only covers children. So in my opinion, children's coverage, children are pretty much healthy, so they don't need a lot of medical services. So that's why it's another reason why it's easier for children to get covered. And another reason, obviously, is children is the most vulnerable. We don't want them to suffer from poor health conditions just because they don't have the money to visit doctors. All right, here's the nice part. The federal level requires at least 133% of the FDL. 46 states and the District of Columbia cover children up to or above 20% of the FDL. And 24 of these states offer coverage to children in families with income at 250% of the FPL or higher. So like I said, it's all different. And the disparity across states are pretty staggering. I'll show you guys later. So Medicaid also has some gaps. 2 million poor and uninsured adults fall into the coverage gap. Okay, so these adults are typically childless, and they actually, like I said, even though they have children and they're not necessarily qualified, just because their children are qualified. So these are maybe either this group should include adults with children or without children. Okay. So many states decided to expand their Medicaid program to cover non-elderly adults in households with income below 138% of the federal poverty line. So this means adults can be covered up to 138% of the FPL in some states, okay? And many states did not have this expansion program for adults. Okay, for adults who are making more than 138% of the FPL, then the ACA Obamacare will provide them with health insurance marketplace plans, so they can get some kind of subsidy for the most part if they buy a health insurance plan using the marketplace plans that are provided by the ACA. Okay, here's the differences across states. I'll just show you real quick. So, like I said, Medicaid basically covers children. Most of the covered population is children, okay? Children, and pregnant women, and then adult, okay? If you look at the last couple columns, so here it says adults, Medicaid, parent, caregiver. Here it says adults, Medicaid expansion to adults. So again, this is required by, this is not a requirement. It became available after 2014 when ACA started kicking in. Okay, so this is provided in the Obamacare, and not all the states have this choice or expanded Medicare, a Medicaid under this provision. Alabama, for example, there's no expansion to poor adults. Florida, Georgia, Idaho, Kansas, let's see, Mississippi, Missouri, Nebraska, North Carolina, Oklahoma, South Carolina, South Dakota, Tennessee, Texas. These states do not have Medicaid expansion for poor adults. And if you look at the percentages, like here, adults, poor adults in Alabama, they have to make 13% of the FPL in order to be qualified for Medicaid. This is ridiculous. Look at Connecticut, it's 133. Look at DC, it's 216%, okay? So the disparity is huge. Idaho is 23%. California, I believe, is close to 133, 109%. So for adult person, whether he or she has child or not, if the income is above 109% of the federal poverty line, then that person in California will become eligible for Medicaid. Okay, this is only before 2014 when ACA started kicking. After 2014, California did offer up to 133%. Okay, so this is why the previous coverage got expanded. Okay, now people who make 133% of the federal poverty line can still be qualified for Medicaid in California. Okay. All right. For Arkansas, there's a huge difference. It used to be 17%, but now it's 133%. So, because many states chose not to have the Medicaid expansion program for poor adults, that's why Medicaid has a big hole in it still. Okay, did we talk about CHIP? Yeah. CHIP is the Children's Health Insurance Program. And like I said, 133% is the least. Okay, so if we go back to that link again, children Medicaid, children separate CHIP. So if you look at here, CHIP, the federal government required 133%, right? Alabama actually has pretty good coverage for children. covers up to 312% for children. Okay. California, I don't know, it says C note. Let's see. Illinois is 313. New York is 400%. Well, New York is the most generous state in this category. Okay, but at least each state covers 133%. Actually, all the states are above 133. See, I didn't see anything like 133 here in this column. Or maybe New Mexico then. Yeah, New Mexico. Where it says NA, there's no expansion for the children under CHIP. Okay. All right. Okay, let's go. Let's continue. So, all right. So, the U.S. healthcare system is often criticized based on its very high costs. Okay. This number is huge. I can't even imagine how large that number is. 3 trillion. Okay. And in 1960 it was only 27 billion. Now it's 3 trillion. Okay. And it's almost 18% of the GDP. Okay. And to give you some idea how much money that is, 5% of our GDP goes to education, but 18% goes to healthcare. Why it's so high? There are a lot of reasons, but I think the administrative costs involved in processing millions of insurance claims definitely is a huge factor that we can't ignore. For example, the government healthcare administration costs $30 billion. And also, excessive administrative costs were estimated to be $190 billion per year. Okay. So, because the complexity of the healthcare system, we have to have more people dealing with claims, working in insurance companies, and so administration costs money. Okay, the simpler the system, the less it'll cost on administration. Like Canada, UK, they do either single payer system or national system, so they save money on administration. Of course, people argued it costs more. America costs more on healthcare because of technology advancement. Americans enjoy technologies like new drugs or new procedures. Okay, I think that benefit the wealthy for the most part, right? Because the poor people, middle class, even upper class cannot afford those things. Okay. Hospital costs is the largest category under healthcare costs, 31%. I think hospital stay is really, really, really expensive here in America. Okay. And they say the cost of technology, construction, and regulatory compliance account for a growing share of hospital costs. Again, technology is a big argument under hospital costs. Physician, what about physician salaries? Actually, American physicians, doctors, they make more money than doctors in UK, Canada, and Switzerland. Not too bad. It's not like a huge difference. There are so many other countries where doctors make similar money as America. Prescription drugs account only for about 10% of total healthcare expenditures, but it's actually driving up healthcare costs. So pharmaceutical company, they make a lot of money, okay? So to lower healthcare costs, American has invented something called managed care. Okay, managed care is a healthcare delivery system organized to manage cost, utilization, and quality. So it does not only manage cost, it also manages services. Okay, so basically people might have a hard time getting medical services they need because of managed care organizations said no. Okay, so the assumption behind managed care is doctors reimbursed by MCOs have little incentive to overtreat patients or recommend unnecessary medical care. Therefore, the cost for healthcare will be reduced. However, if you look at the numbers in the past 20 years, it really didn't change anything. The cost kept going up throughout the years, even though a lot of Americans were enrolled, virtually, were enrolled in MCOs. HMO is one type of MCO, and 86 million Americans were enrolled in HMOs. There's also PPO. Okay, so like I said, managed care is not popular among Americans, okay? They hated the paperwork, they hated the denial of services. Managed care, especially for specialist services, okay? I had a lot of trouble with my health coverage. Yeah. So, it's really, really difficult to get specialist service if your plan is HMO. Okay. So like physical therapy is considered specialist services, right? I can't just go to a local physical therapy office and get services. I have to go through my PPA, PCA, primary care physician, PCP, and get their referral, okay? And their referral will expire in like maybe a few months. So if I stop going for any reason and then I decided to go back to the physical therapy, again, I have to go through my PCP again. Okay. All right. So the high expenditures are not necessarily equated with positive services, better services, or positive outcomes. For example, the life expectancy and infant mortality are below that of other Western industrialized nations, okay, which is not good. United States has also a relatively low number of hospital beds and physicians per capita, and patients in the United States have fewer hospital and physician visits than in most other industrial countries. So we're not getting better services, and the outcomes are not good. If we look at life expectancy and infant mortality, And again, we're the only industrialized country that does not provide healthcare to everybody. So here is the Canadian system. I just wanted to show you guys a little bit of how Canada does their healthcare, and it's not without controversial here in America. Okay, otherwise we would be having a similar system already, right? Many Americans don't like Canadian system. Okay, so but they do have public administration, like to keep the costs down, right? The cost on administration down. It is very comprehensive, not like Medicare. Okay, we have 4 parts, but still some services still cannot be covered. So their coverage is pretty comprehensive. It's universal. Everybody has coverage. It's portable no matter where you live across Canada. It's accessible. And it's freedom of choice. People can pick what doctor they want to use. Okay. Because there's a lot of issues with the American healthcare system, different proposals have been made to reform it, okay? And in 1990s, Clinton administration almost succeeded in passing a national health insurance plan, but almost, okay? So I guess we need to wait longer before that can happen. So more recently, Obama was able to pass the ACA Affordable Care Act, or Obamacare, that made some revisions to the existing system. So like enrollment is required for most Americans, okay? It's not universal requirement, like everybody has to buy insurance. So these are some groups that are exempted from this policy. There's also health insurance exchange. This is what we just talked about. People just buy their insurance on the market and then get subsidies. Okay, this is when people can be qualified to receive subsidies. Not everybody can qualify for the subsidies. There is stricter regulation on the health insurance industry. Okay, for example, lifetime caps must be removed, and they cannot deny children or adults coverage based on pre-existing conditions, just to name a few. And another thing that Obamacare did was the donut hole is getting closed. I think starting next year, the donut hole will be closed completely. Medicaid, again, we talk about this. Medicaid is expanded to poor adults. All right, that's all for today. Thank you for watching. If you have questions, let me know.